So we'll make a start. Big welcome, everyone, to today's webinar event. Today we're going to be focusing on the final year project of this MSc Transformative Oncology course and get some student experiences from Sam Preston, who's joined us today, who is a final year student on our online MSc Transformative Oncology course. My name's James. You've probably seen me on email, or maybe you've talked to me before. I'm a course advisor for this Transformative Oncology program. So I'm here to give you any guidance you have if you're looking to apply for the course, answer any questions that you have about the course. Sam, I'll hand over to you just to give a quick introduction about yourself. You'd like to tell us a bit about who you are, what you do, and where you're up to with your studies with us.
Hi everyone. So I'm Sam. I currently work as a practice development nurse in the independent sector, delivering chemotherapy to patients' homes. And I have just submitted the last parts of my final year project as part of the Transformative Oncology. So we are the first group to have done this course, and so we are just coming to the end now. So it's a very exciting time. A little nervous because we want to make sure we've passed.
I'm sure you have. I'm sure you have. Brilliant. Thank you for that, Sam. Yes, so Sam is a member of our first cohort that started this program 3 years ago. So time flies, right? So for people who might not have a full understanding of what this course is, I'll just explain a little bit about what we offer here at the University of Manchester. So 3 years ago, Dr. Suzanne Johnson started an online MSc in Transformative Oncology. This course is available as a full MSc or a postgraduate diploma or as a postgraduate certificate, and it offers you a chance to study oncology with the University of Manchester online and part-time. So you can study wherever you are in the world alongside your job or whatever other commitments you have going on in your life. So it's a very flexible course, and we have a new enrollment in September this year. So if you are interested in applying, please feel free to get in touch with me, or you can directly apply on our course webpage. We do have an early application discount that does expire quite soon. So today's June 26th, so that early application discount does expire in 4 days. So if you are interested, it'd be good to apply before then to lock in that 10% early application discount. So this course, really exciting to learn a little bit more about it from a student's perspective, with Sam telling us a little bit about her experiences on this course. Also, for anyone joining the call, feel free to ask your own questions in the Q&A as we go through. It would be great to get some questions from you too. So I'll get the ball rolling, Sam, with a little bit of a Q&A to get an understanding of your time on the course. So you said you just finished your final year assignments. How's your final year gone on the course?
It's probably been one of the more challenging parts because it's a lot more self-directed. There is a lot of support from the university and from experts. You know, the good thing about studying with Manchester is you have access to amazing experts in the field of oncology and things. So there's lots of resources available, but it is a lot more self-directed. So there is even more discipline involved in sort of getting the work done around life, work. You know, we're all working professionals on this course. So it's definitely been a challenge, but it's been very rewarding to get to the end of it. And I've learned quite a lot. And I think it's really important when you're thinking about what to do for sort of the research proposal is find something that does a dual role. So it's something you're interested in, but could also potentially benefit you in your work. So you're doing sort of a 2-for-1 kind of thing, because there's a lot of work involved in it. So yes, it's been challenging, but very rewarding, I would say.
Okay, great. Well, you mentioned about the challenges of balancing those commitments that you have. So for people who might be interested in doing this part-time, do you have any advice about how you've been able to balance those commitments? Any good tips?
So a lot of the time, so I'm fortunate I work long days, so I do 4 long days a week. So I have a Monday. So I would actually block out a Sunday and a Monday, depending where I was in the module or how much work was involved, because some modules were more science-based. So for me, when the biomedical scientists are talking, it's a lot for me. So I would take a longer time to absorb the information. Some of them were more in my wheelhouse. So just depending on what was being sort of taught, what we were expected to do, I would block out Sunday or block out time, non-negotiable, because before you're like, oh, I'll do it next week. You don't need to put that pressure on yourself. I know it's easy done. I made that mistake the first couple of modules and was cramming it in 3 or 4 days. I would not recommend. The stress levels were not healthy. So yeah, carving out time, whatever works for you, whether you're an evening person, morning person, but I would say as well, a decent block of time. So not try and do like an hour in the morning. You need a substantial sort of to get into it, I would say. But yeah, be quite strict with yourself because you'll thank yourself when you get towards the deadlines. Don't leave all the module content for the week before the essays are due in.
Absolutely, yeah. I imagine it's easier said than done to do that straight from unit one to just you know do it. You kind of have to learn from experience maybe of how much it is, but it is good advice. If you are thinking of doing the course, make sure you keep on top of your studies. You don't want to leave it all to the last minute for sure.
Yeah.
But yeah, we have all been there, that's for sure.
I say this, I still leave certain bits till the
Yeah,
essays may well get left till just before the deadline, but we're all human.
it's well timed then. As
Yeah,
long as it's before the deadline, you're doing okay.
exactly. And I would say as well that there is loads of support. So if you are struggling to meet the deadlines, the university does understand that we're working. So speak up early. If you're struggling with anything, they do offer support, and those sorts of things as well. If there's areas you're struggling to understand, again, get in touch with the tutors. They're really, really helpful, and they're specialists. So they want to impart their knowledge. They're really keen. So yeah.
Yeah, that is a very good tip to definitely speak up and let people know where you're at. If you're struggling with anything or if you're excited about anything, whatever it is, get in touch with your academics and people who might be able to help you or support you with anything. Definitely good tip. So you mentioned that you've pretty much finished your studies. You've done your final research proposal. What was the topic of that research that you chose, and what inspired that decision to choose that topic?
So one of the things I really liked in this course was kind of because obviously I work in nursing, so I'm very that side, but it was all understanding all the underpinning science and biology, and a lot of talk around genomics, which is a massive word in cancer at the moment. So the course has sort of enabled me to better understand a lot of these terminologies way over my head. So I wanted to look at potentially how we could use liquid biopsies to improve patient outcomes in the independent sector in where I work. So I looked specifically at a cancer type just so that I could focus the research, because you don't want something too broad, but you also don't want something hyper. So I looked into whether it's feasible to use liquid biopsies to monitor for recurrent and progressive ovarian cancer in basically a group of patients, because with ovarian cancer, it has a high rate of reoccurrence, or high-grade ovarian cancer, I should say, high rate of reoccurrence. And a lot of the evidence is suggesting that liquid biopsies could pick progression up earlier, we could change treatments. It's not going to stop the end result, but potentially it could improve quality of life. So it was looking at all these facets. So there was parts of nursing in there looking at quality of life, but then there was sort of the scientific elements of it, looking at, does the science exist yet? Is there enough for us to be able to run it for liquid biopsies? And I know, they've been in the press recently. The NHS has rolled them out for diagnostics in lung and breast. So they're a big thing. Panels are always changing what they're looking for, but the course gave me the understanding, so I can kind of talk about it to my colleagues as well in simplified terms, because I find you have to know at a high level to be able to simplify. And that's what the course has done. So that's where I said, like, doing a 2-for-1. So I have a real interest in genomics and how that can benefit patients at all stages. So you've got them at screening, you've got it at diagnosis, and now looking at through treatment and beyond. So monitoring. So yeah, that's kind of where I decided to sit. And like I said, you have to be interested because it's a lot of reading.
Sounds fascinating. To be fair, that's a really great choice. So you mentioned a little bit about having that understanding, sharing that knowledge with colleagues in a more simplified way, because you have that understanding of that. So as well as that, do you see any other directions or ways in which you can apply what you found from this research in your job role?
So yeah, I've been in talks with a few people that we have a lot of cancer specialist nurses, but about creating a role around a genomic specialist nurse, looking at the counselling that patients need for any genomic testing, because this is something that's going to keep occurring. And if we're looking at the independent sector and more genomic testing being done as part of patients' pathways, being able to facilitate that. So there's kind of this maybe sort of expansion of a specialist nurse role to sort of liaise with consultants and labs and all sorts of things. So it's in the ether at the moment, but this is how literally this course could create a role in where I work and benefit patients in the long run, hopefully. So yeah.
Absolutely. Thank you. So focusing then, let's talk a bit about your, so you've done the research project recently. How did your previous units on the course, so I believe you do several units before doing the research project.
Yeah.
How did the knowledge that you took from those units support you as you progress through your research project?
So they all had, pretty much every unit that we did had some relevance in sort of coming into the research project, because it helped build, in some cases it might be building on my foundational knowledge, or giving me new knowledge. Underpinning of like the heterogeneity of cancer is a massive thing, so the understanding there. Then looking at more of some of the patient focused things, we had talks from sort of surgeons as well, and across the spectrum of people. So I would say every unit had some relevance into feeding into the research proposal, because it's all relevant in cancer. It's such a broad subject, but I think it prepares you as well, because the structure that you follow through each module is very similar to how they've then structured the research proposal, because it's effectively one piece of work but split up over, I want to say six modules, the research proposal. And that's very similar to each unit. We did, I think, between 5 and 6 modules a year. It might be more, don't quote me on that. It's blurring into one big module now. But they followed the same structure. So you would have tutorials interspersed, synchronous tutorials interspersed with sort of soft deadlines where you could get feedback, and then you had your submissions. And that's how the research worked as well. They split it up so that you don't get overwhelmed with the amount of work that you need to do. So especially if you're doing this part-time, it makes it seem more manageable than being given, this is a research proposal, crack on, we'll see you in 6 months. So even just learning, that process of going through the motions of going through a module helps you in this project as well.
Absolutely, yeah. So on the project, did you face any challenges, any significant challenges that you had to overcome?
I would say, as much as I say, time management is one, especially fluctuating with how busy I am in my own work, so that can impact it. I would say sort of trying not to, when you're looking particularly into sort of the underpinning research, like what's being done and what's available, your literature searches and things, making sure that I didn't go too narrow, because I needed to talk about how they're already used. So it's that sort of thing, like refining your research, refining your question. That was all very new to me, because, and building it from scratch, you know, I've been involved in research, but it's that all that stuff's been done, and I'm just going, oh, okay, we need this many patients, but this starts you from, you know, the underpinning theories of research. So yeah, that was quite a challenge to get my head around to start with, but we got there.
Got there in the end. Yeah, absolutely.
Yeah.
That's great. Well, anyone in the audience, feel free to ask any questions that you might have. It'd be great to get some from people who might be interested in studying the course. If you have any questions that might clear up things for you, we do have one so far in the Q&A. So we have a question about the final research project being clinical, in a clinical setting or a lab-based setting, or is there an alternative setup for the research project? So what choices did you have when you decided to do your research?
It was complete free choice as to what we chose to research, and it was influenced on where we worked. So obviously I can only talk from my perspective as a nurse. I know one of my colleagues on the course, so she's over in Hong Kong, she's also a nurse. I think we've got a GP, I want to say. We've definitely got a couple of doctors as well, so their fields are different. We didn't have any sort of scientists on us, but there would be no reason why you couldn't choose something more lab-based to research, because again, you would have another perspective, and that's something that you're interested in. But it's, like I was saying, so I was looking at some of the science. So if you were doing a lab-based one, it's looking at maybe including some patient outcomes or outcomes in that, just to sort of include all aspects of the course, I would say, because that's the point of it, that you sit between both the science and the medicine. So yeah, it's wherever you work, it's going to be relevant.
Yeah, absolutely. Yeah, thank you. There's another question here about any sort of further advice for students looking to do this course, maybe advice for students starting the course, or perhaps there's some students on the course that are joining us today, maybe going into their final year next year. So any advice for prospective students or current students on this course?
I would say for prospective students, go for it. It's been really, really beneficial. And like I said, our cohort was actually quite small, but we're across the world, and we've all found, you know, been able to take so much back into where we work. It's, you know, my knowledge has grown so much. My colleagues now roll their eyes when I start talking about certain things, because I go off on tangents and they're like, just shh now. So it's an invaluable course. I'd say from the nursing perspective, it was one of the only masters I could find that didn't have prescribing and advanced assessment, because that's not where my interests lie. So, but still within the oncology setting. And like I said, I've found it really, really interesting, and there'll be lots of benefits moving forward with it. For current students, you're nearly there. The third year is probably, like I said, the most directed by yourself. But remember that, you know, hopefully you've got your WhatsApp group set up, or you talk to the others on your course, and you'll need each other through this, because it can be challenging, especially if you're not used to writing a research proposal from scratch. Some of the terminology can be quite confusing. So again, asking for help. And I would say that whether you're prospective, newly starting, or ongoing, is there's such a wealth of resources at Manchester University that don't sit and suffer. I think that's one thing we can easily fall into doing, especially on an online course. It can feel quite isolating. So making sure that you reach out and ask the tutors for help, ask, you know, the guest speakers. They're all willing, they want to impart their knowledge to the next generation of learners. So do use those resources. And those that are going into their research project, good luck and find something interesting.
Absolutely, like you say, that you've got to do a lot of reading on it, so you've got to find something that you like to read about.
Yeah.
You mentioned in your answer just then about the WhatsApp group. I guess that's sort of something set up between the students and then also reaching out to academics. So that actually ties in quite nicely with the question that we've just had about the community on the course. So how has that been? I guess that's sort of student community, but also the student academic community as well. How has that been?
Yeah, so right from the offset, we had to deal with time zones. So straight away we worked out the best time for us to have the synchronous tutorials was going to be UK time, normally I think it was 1, 2 o'clock in the afternoon, because I think that meant it was about 7 p.m., 8 p.m. in Hong Kong. So that was the one we had to switch for. But it meant that it fitted into all of our days. So we did that start with, straight away we started a WhatsApp group because we could leave messages in there because we all knew we were working and things. And especially when we're getting towards deadlines or things people weren't understanding, we would chat in there about it and someone would go, oh, I've raised that, or, you know, that's not clear, or don't worry, I've sorted that, those sorts of things. So there is, even though we were a very small cohort, there was that sense of community. And we did see each other on our synchronous tutorials, apart from one person that was always in like clinics, could never have their camera on. So hopefully they'll be at graduation, I'll finally be able to see their face, because I've only ever just seen the blank grey picture and heard their work, heard their voice. So yeah, I think it is a little more effort to sort of grow that sort of community on your course. But it's worth the effort because, you know, the good thing about this is we've had worldwide perspectives. So it's not just NHS focused. I found out loads about sort of the health care system in Hong Kong and in Uganda, things that I would never have known about. So it's really interesting from that sort of perspective as well with your fellow students.
Absolutely, yes. It's nice that you mentioned graduation as well, because you can attend online, but also you can come on campus for your graduation. So it's a nice day for everyone. If I know people might travel a long way to make it, but yeah, that's, I guess, when that community of students does finally come together and get a chance to meet in person, which will be a really fun day for everyone.
Last I heard, the girl in my cohort from Hong Kong is going to fly over for graduation. So that is one hell of a commute. I can't moan about a 3-hour train. She's flying over. So that's going to be lovely to sort of celebrate together after 3 years of sort of messaging and seeing each other on Zoom calls.
Absolutely, yeah. Be a great day. We've had another question here. It's a 2-part question. I think I'll be able to answer some of this, but it'd be good to get your perspective as well, Sam. So one part of the question is, would I need a laptop or would an iPad be sufficient to study on this course? I would recommend a laptop. I think that you're going to have to do quite a significant amount of research, online research things. And I know iPads are pretty good, but they probably for academic research purposes don't quite match up to a laptop. So I would probably strongly recommend investing in a laptop. Would you agree with that, Sam?
Yeah, I would. And in fact, if you have a laptop and an iPad screen, it's quite handy because you could have a journal article on your iPad and then be writing notes and things or writing your essays. I'm very bad. I'm very tactile, so I need to have printed journals with highlighting and things.
Okay.
But again, I would find from a comfort and the programs that you're using, because I know you're changing your platform, but sort of the learning platform is on one screen. You might have, you know, a Word document, or, you know, on another screen, so that can be quite tricky on a tablet. So I'd say definitely get yourself a laptop.
Yeah, I think you're right. Multiple screens can be very useful. And then the other part of this question was, so I'm from a neuroscience background from my undergraduate studies. However, it's been a few years since studying. Is there any preliminary reading that you could recommend, or is there a sort of minimum standard of understanding required before beginning the course? And if so, which topics? So, Sam, maybe you could share if there's anything that you found useful before you started studying or any preliminary reading. And also, I can send over some resources to you after today's event for further information on that. But Sam, what did you find useful?
So when we first got access to Blackboard and things, there was a whole section on sort of pre-reading. So, for example, I last did science, apart from my nursing degree, was actually at GCSE. I didn't do any A levels in science, and now I'm being taught by a biomedical scientist. So that is a big leap. So in the first start, that was quite overwhelming, and we spoke to Suzanne, and she provided extra resources. So those now sit in as sort of pre-work, so guiding you to sort of help build that knowledge up to a level. But again, use your cohort, because you'll be surprised what knowledge other people come with, and the tutors as well. Like, they'll be able to support you to sort of build that foundation knowledge. But the course is designed that you will start at a sort of a level and continue to develop that. And as James says, he'll have some resources for you. But if you have, a basic understanding of sort of cell biology and things like that, that's always going to stand you in a strong stead. But you'll be guided by the resources as well to facilitate that.
Absolutely, yeah. Yeah, the summer's certainly a good chance to do a bit of preliminary reading, and then you can really hit the ground running in September. I'll send an email out after this event to everyone that's joined. So if you want to follow up with the email I send, and I can send over resources to anyone who needs those, with some links to that. So that's all the questions that we've had. If anyone's got any questions, any more questions, add them in now. We'll get to them quickly. If not, then we are pretty much coming to the end of today's event. So I think we've managed to answer everyone's questions there. That's great. If you do have any questions that you think of after today's event, please feel free to email them across to me at studyonline@manchester.ac.uk. Also, if you have any questions about the course or how to apply for the course, you can email me to the same address. And check out our webpage as well, our course page, for further information on the course. There's lots of valuable resources on there that you can access and learn more about the course. And yeah, keep in touch and let us know if you have any interest in studying with us. It'd be great to hear from you, and I'd be happy to help with any questions that you have. I don't think we do have any more questions in the Q&A, so that works out nicely for our time slot. Thank you so much, Sam, for sharing all of that information and insights. It's really valuable stuff there, and I think that our prospective students really appreciate hearing it from a student's perspective. So that's really great. Thank you so much for that. And thank you everyone else for joining today's event. I'll be in touch with everyone after the event today with a follow-up email, so look out for that. Thanks again for joining, and we'll see you all soon.